Hello, everyone. Thanks for making it out today. I'm Daniel Heimpel. I'm the publisher of an online news site called the Chronicle of Social Change. We're lucky to have one of our board members here, Kathleen Strotman. Hi, Kathleen. Thanks for making it out. We also have some representatives from Generations United. Thanks, Jaya, for coming out. From the Children's Defense Fund. Thank you for coming out as well, Stephanie. There's Teresa Wiltz is here. She's probably the only reporter in America who's covered family first and child welfare with any kind of regularity. Karen, thanks for coming out from First Focus. Deirdre, thank you for coming out after a tough election cycle and all your hard work on child welfare issues. We also have Jeremy Long here. He works for the administration for the Associate Commissioner of the Children's Bureau. And we have all of our folks coming up from UPenn, Sarah at the Field Center, Johanna Greason coming up from the School of Social Policy and Practice, and then we have our panelists here as well. I'd like to welcome Jennifer Jones. Jennifer Jones works at the Changing Minds Institute, runs the Changing Minds Institute at the Alliance for Strong Families and Communities, which, if you don't know them, very kind of influential association focused really heavily on child welfare policy. Arnie Eby, foster dad extraordinary, and also the head of the Maryland Foster Parent Association, and Ioana Marinescu, who is a labor economist with the University of Pennsylvania's School of Social Policy and Practice. So thank you all for coming up here. So what I want to talk to you to start us out is this report that my organization did. We wanted to try to determine foster care capacity, so the amount of homes you have relative to the number of kids in care. This is something that the federal government, I don't know, Jeremy, if you're going to start fixing that, but the federal government doesn't really count foster care capacity too well, and I think this is a very important thing for us to think about as we're starting to change laws to step children out of group homes to the degree that there are placements for those children, as well as to the degree that family members are stepping up and taking care of kids. Just a little bit about us. We're a nonprofit news organization, Fostering Media Connections, which has two publications, one of which is the Chronicle of Social Change, our online news site, as well as Fostering Families Today, which is a print publication that comes out every other month and distributed to child welfare administrations across the country and gotten out to foster families. So we have a direct line to foster families. We did this particular project by sending records requests to every single child welfare agency in America, as well as sifting through AFCAR's data, which can be kind of difficult, but we managed to do it to some degree. Ioana knows it as well. And a lot of this data that we're going to be sharing is not really published anywhere else or shared anywhere else. We have been kind of on a little tour talking about this stuff. So we've been to Los Angeles, we've been to Atlanta, Georgia, and we've been to Chicago. And, you know, I think when you travel this country and you kind of see where foster care is and child welfare is, you see a lot of different things happening, positive things. That first stop in LA, we got to meet with a church in South LA that was recruiting and retaining foster families. Bye, Kathleen. And in Atlanta, we talked about that state's really heavy use of relative caregivers. You can see Eugene Vickerson, the man in the closest African-American man, 72-year-old grandfather, who's kind of chewing out the head of the child welfare agency there, saying that there needs to be more supports for relatives. What we're going to be talking about is the types of placements there are. So you've got relative homes, some of which are licensed. So, you know, when you enter the system, you can either be licensed, or the system may license a foster parent, or the relative may be unlicensed. We have non-relative foster homes, and then we have congregate care, which means settings where you got 6 or more kids, you know, commonly referred to as group homes. So last week, the federal government released its data on the overall number of kids in care. which what you see there, the 443,000 number, is the projection we had for last year. So every year the federal government releases its data. It's a year behind, so it's September of 2017 data. How many kids were in care in September of 2017? We asked that question in August of 2017, and last year we estimated that there were 443,000 children in foster care. How many kids were in foster care according to the federal count this past year? 442,995. So we were off by 5 kids for the entire year, and we were a year ahead. Nothing wrong with the federal data collection. We just happened to be doing it in real time then. This year, we did the same count, and we have numbers dropping down to 439,020. So you're seeing, I think, next year you will see a slight decrease, and the importance of this is that foster care numbers have been going up for the past 5 years straight. So we are projecting that those numbers will start coming down again slightly, which of course in the long run is something that kind of can influence the conversation we have. Hello, Representative Bass. Thanks for coming in. So those were some of our findings. We also looked at where those foster youth are placed, and something you'll see here is that red line is the amount of relative placement. So you've seen as the numbers of kids have gone up over the years, relatives have increasingly stepped up to take care of that burden and are not always getting paid as much as non-relative caregivers. So in 44 states between 2012 and 2016, you saw an increase in utilization of relative caregivers, and in 23 of those states, no payments were given to more than half of the children living in relative placement. So that's, I think, a big pressing question for federal lawmakers like Representative Bass here, who I'm going to invite up in a second. But how do we do things to help relatives more? So those were some of the numbers I just mentioned. You also see, despite a big move away from congregate care, so a big move away through Family First, this federal bill that was passed in February of last year, to reduce reliance on congregate care, you've seen that actually going up. 31 states have placed a higher percentage of foster youth in those types of placement. And of those, 18 states saw an increase of 50% or more. So while we may have this dream of moving away from these types of placements, for whatever reason, systems continue to utilize them. So that's going to be a question in terms of implementation of Family First. In 2017, more than half of the states we estimated had a decline in capacity. Of the 24 states that we compared between 2017 and 2018, 14 lost foster homes. These are non-relative foster homes. So you've seen some winnowing in capacity. And I think some of the big questions, and I'd love, I know Representative Bass, you've got ideas of things you want to discuss, but these are the questions I have really for all of you who are going to go back to your congressional offices. How are you going to support? How can the federal government support the recruitment and retention of foster youth? The reason why I ask that is in California, in the last 3 years, as they tried to step out of congregate care, they spent about $135 million in 4 years. The Family First Act has allocated $8 million over 10 to try to recruit and retain foster parents. So there is some kind of disparity there. And is the federal policy regarding relative caregivers adequate? I would argue that if you have a two-tiered system wherein licensed relatives are getting paid more than unlicensed relative, and in some states licensed relatives are getting paid less than licensed non-relative caregivers, that we've got some issues to deal with, especially as the system has increasingly relied on relative caregivers to step in. And I know, Representative Bass, before you came to Congress, and before you were obviously dealing very deeply with how to support relatives and how to keep kids out of the system by virtue of keeping them with their families. So with that, we're going to get to our panel, but I'm just so happy that you're here, and I'll invite you up. Thank you, Representative Bass.
Well, good afternoon, everyone, and thank you for the invitation to be here. I do want to say, though, that the work that you do, Daniel, with the Chronicle and all is just really fantastic, and we need to give him a round of applause for his leadership over all of these years. I really mean that. I think that it's a very important document that we can all use, and the leadership is just really critical. I actually got involved in the whole child welfare issue because of relatives. So in the 80s, when the crack cocaine epidemic hit, and I started an organization in response to that epidemic, and we started getting all these phone calls from grandmothers saying, you know, CPS just left all these kids, I don't know what to do, I need some help. And we started organizing the grandmothers, and we formed this group called Kinship in Action. And it was basically lobbying the Board of Supervisors and the state reps that Ken needed support. We've come a long way, because that was 28 years ago. And during those time, especially fast forward a few years later, I went up in the state legislature, and I found that the view of relatives was very negative. It was like, you know, the apple doesn't fall far from a tree. Why should we support you? This is your moral obligation. And it took a lot of education of policymakers to see that actually, I mean, and that was before we knew how better it was for children to be with families than to be with strangers. And so, but to educate policymakers why someone would need help. And so we spent a long time doing that. Well, I think what's good now is that I think that's changed. I mean, I think people do understand. I remember when the AARP came out and started documenting the fact that, you know, so many relatives were now taking care of kids. Well, so now here we are, fast forward 28 years, and we're in the middle of another drug epidemic, the opioid crisis. And so I think it's another opportunity for us to make those connections with policymakers, because I can tell you, since the policymakers are my colleagues, people are not connecting the dots with opioid and child welfare. They're thinking about opioid in a different kind of way. At least they understand not to throw everybody in prison, which is what we did with crack, but they're not making those connections. So educating policymakers, I think, is real important. And then the question you made, those questions you have up there, I would really like to explore, because I think, again, in using the opioid epidemic to teach people about the connection, then we can talk about what is the federal government doing and what kind of resources should we have. It's fine to say we want to get rid of congregate care, but I remember when we decided to get rid of mental health hospitals too. And now we have a huge, you know, homeless population. So we have to make sure that we don't, in trying to solve one problem, create another problem. And often we say that, and then we don't support what we actually want to have. So I think, given that it is a new day in Congress, that there might be opportunities to seek resources for relatives, whether it's the public education campaign or whether it's providing supportive services so that people can take in their children. And then Daniel and I were having a whole conversation last night. I don't want to go into it, but I want to just raise the issue, and that is the children on the border. So I am concerned that many of those children are going to eventually wind up in the foster care system, and then that's just going to add even more pressure to the system. So I'm certainly hoping that we can resolve that problem at the border, but I do think we need to be aware of it. And I think for everybody here, we need to be tracking if these children are making their way into our systems. That's going to add additional pressure. So hopefully we'll be able to get that information back anecdotally or otherwise. So I just want to thank you very much for the opportunity to speak with you. You know, I do whatever he tells me to do. So we'll get busy and answer those questions with some policy and hopefully some resources. Thank you.
Thank you so much, Representative Bass, and thank you for your help in securing this room and giving us a place to do this. So thank you so much. Thank you. So now I'd like to jump into the discussion a little bit more deeply. We are going to hear from Joanna first.
Thanks. Good afternoon, everybody. So I'm a labor economist, and I'm somewhat new to the issue of foster care. The way I look at it is by understanding the economic factors behind getting parents to become foster care parents. And so, we've been looking into a number of factors, and, I want to summarize some of what we've found for you today. So the team is composed of myself, Johanna Greason, who's here, Deborah Schilling-Wolf, and our wonderful research assistant and now co-author, Faye Tan. So, first of all, just to place foster care parents in context, if you look at census data, which is a representative data of the US population, you can see that foster parents, if you compare them with parents in general in the US, foster parents tend to be less educated, they are less likely to be working, and they are more likely to be disabled. Therefore, there are reasons to believe that they are more likely to face various economic barriers for anything that they might want to do that might cost money. And so, for example, one economic barrier that you might think about is regarding housing. So in order to be a foster care parent, you have to provide space for your foster child. And so in order to provide space, you have to be able to afford that space. So one of the things that we've been looking at is the price of housing. So this shows you over time, starting in 1996, how housing prices have been going up. And then, of course, there was the crisis in 2007. But since then, housing prices are somewhat flat and more recently increasing again. And so that gives you an idea of the general level of affordability. And remember that rents are related to housing prices because, when houses are more expensive, rents are also more expensive. So the whole thing is highly correlated and moving together. So what we found in our data is we found that actually higher housing costs are associated with a lower number of foster care placements. So trying to interpret the impact of housing prices on foster care parents is a bit complicated. Because if you think about it, this can affect, housing prices can affect two actors, both the foster care parents, the potential foster care parents, as I just explained, it can affect the affordability of housing a foster child, but potentially it can also affect birth parents and the potential difficulties that they're facing in their lives, and that can have an influence on the outcomes of their children. So, so that's just a potential caveat in interpreting the data. But if we focus now on the prospective foster care parents, what we think is reasonable to think is that higher housing costs could reduce the affordability, right, of taking in on an additional child, because you can't afford that space to be able to house that child. And so, in fact, we find that across states, an increase in housing prices within a state is associated with a lower number of placements in foster care in that state. So basically, when costs go up, housing costs go up in a state, then the number of kids who are placed goes down. And that could be explained by a lack of affordability on the part of foster care parents who aren't able to afford the kind of space that they need to house a foster child. So that's the first thing that we looked at. And so the second thing we looked at, there's some cost issues, in particular with housing, but then let's think about, are the foster parents helped? How can we help them? Well, one way that we do this is by providing some payments that, Daniel just discussed. So in general, this is just data from AFCARS, which is the national clearinghouse for foster kids. So you can see that the payments to foster parents were going up until about 2007, 2008, and since then, they've been more or less flat. So the question we want to ask is, does it help if you will compensate foster parents more? Does that somehow relax their affordability constraint, make it, more feasible economically to take in a foster child? And so to look at this, we looked at every state and we asked the question, when a state increases their payments to foster parents, are they able to place more children? And in particular, in the next figure, I'm going to show you the effect that we estimate when a state increases their payments by 10%. What is the percent increase in placement in foster care that they're able to obtain with a 10% increase in the payments to parents? And so this is what we find. So the first bar there shows you in general, overall, if we don't distinguish between kin and non-kin, then you see that a 10% increase in the payments to foster parents increases placements by about 0.94%, or about 1% basically. And that's very interesting because when it comes to payments to foster care parents, unlike housing costs, right? I told you housing costs could influence both potential foster care parents but also the birth parents. Now the payments to foster care parents, by definition, only influence foster care parents. So we know that if something's going on, it must be on the side of the foster care parents. The birth parents aren't going to be influenced by payments to foster care parents. We don't think so. That's a whole other phenomenon. So here, we're basically measuring the reaction of foster care parents to getting those additional payments. Then we broke it down between kin and non-kin. And I think, just in light of what Daniel just told us, that's very important because as you heard, kin are often not paid or paid less than non-kin. And so we estimated separately the impact of giving more payments to the non-kin and to the kin. So in the middle, you can see the impact of paying kinship foster care parents more. So that is even higher than average, so the increase is 0.96%. Whereas if you look at paying the non-kin more, the increase is only 0.65%, or significantly less. So basically the story here is that if a state starts paying the kin foster care more, they are able to increase placements, also if they start paying the non-kin foster care. But the difference is the efficiency of a certain increase in payment is greater if you pay the kin. Basically, there's more placements that occur that way than if you pay the non-kin. Both work. Both expand placements. However, paying kin works better, and that might be partially because they are not getting paid very much, and so there's a long way to go to help those people, face their financial obligations that they have when they take in a foster kid. And hopefully, our other panelists will tell us more about how that looks like on the ground. So then, to conclude, what we find is that there are significant economic obstacles and affordability issues for foster care parents, and that these issues can be addressed by increasing payments to foster care parents, and in particular to kin, in order for them to be able to face their economic obligations when they take in a foster kid. Thank you.
Arnie.
I'm going to try it without my glasses because what I have to talk about is not filled into pie charts or bar charts or anything. It's just comes from 15 years of being a foster parent and working with well over 110 different kids in our home in those 15 years. My name's Arnie Eby. I'm from Hagerstown, Maryland, and I have worked with the Maryland Foster Parent Association, volunteered with them for over 12 years, and have just recently, am moving from being the president to their program manager, working with their grant. So like I said, my wife and I've had 110 different kids over the last 15 years. The first group of them came one night, and it was a sibling group of 5. They were almost 2, almost 3, almost 4, almost 5, and almost 7. At that point in time, we had 2 biological daughters that were almost 3 and almost 7. So in one day's time, we went from 2 kids under 7 to 7 kids under 7, and it stayed that way for 13 months. Those 13 months are what changed my life and what projected me into this advocating not only for foster kids, but foster parents, and then understanding as well that if the birth families somehow could get the resources we got, even though I don't think they're adequate as a foster parent, that they could probably maintain residency with their children, or hopefully at least a more connected relationship. The first thing I'm going to say is a barrier for foster parents as we look forward into the future is the stipend, and I think that was one of the things that she showed. It has not increased much over the last 10 years, and at the same time, everything else has gone up. So the stipend generally covers these items: basic transportation, food, In some states, you have a prescribed clothing list that you need to supply for the child. That is all in the stipend. And other states have the requirement that depending on the age, your child also gets an allowance out of the stipend. So stipends get used up very, very quickly. They don't cover, if you break it down by a dollar per hour range, it doesn't really even give you enough money to pay the babysitter. If you're going to have a babysitter, you're adding money along. The other thing that is a real difficulty is daycare. I thought it was fascinating that your report said that foster families aren't working, or it is a reality. Daycare costs a lot of money. If your state actually has some daycare reimbursement, it's generally inadequate. The hours probably don't fit your work schedule, and the balance that you have to pay to maintain daycare totally burns up your stipend. Another thing that's very interesting is some of the housing requirements needed for a situation, needed in your housing situation to provide foster care. These housing requirements are also a barrier in kinship, particularly if kinship providers want to be licensed. States are interpreting through their fire marshal's office living space very differently. Egress windows and those kind of things are very, very costly, and in some states where they are requiring significant changes, those changes cost in excess of $5,000 per thing, per item, if you have to put an egress window like in a basement or something of that nature. So it becomes cost prohibitive for a new foster family and or kinship families to move into the arena of being licensed. Another issue is respite care. Kids coming into care, and as we look at a spin down, as I refer to it as, of kids coming out of congregate care and group homes into traditional foster families, they're going to have a different set of issues. These foster families will need scheduled respite to rejuvenate. They're going to need opportunity for peer-to-peer review and to keep on top of the issues that are happening. I have 2 adopted teenagers, and let me tell you, I have to stay on my toes constantly to figure out what they're going to bring home from school next. It is incredibly tricky, and there's some days I feel like I'm getting far too old for this, but the peer-to-peer review is where you get the energy, where you get ideas, where you get the just the will to keep going, where you are able to share your frustrations, you're able to share your wins, your losses, and then go back ready to make the difference in the life of a child again the next day. Emergency respite is also an interesting thing. What happens if there's a death in the family and you need to leave quickly and go out of state, or there's some kind of medical emergency in your family? States are doing, in my opinion, a terrible job of providing emergency respite. If it is available, or if there's a few amount of funds, it does not cover, or there's not anybody to do it. So I think respite is a huge, huge thing, and that we need to think about, particularly for these families as we move to the future. In closing, the rewards of fostering are not monetary. I can tell you a million stories about why I keep doing it. But as our capacity is depleted, as states lose capacity, economic barriers do exist, and some of the things that I just mentioned can be eliminated or can be eradicated, hopefully, with funding changes, policy changes, because I would love for all of you to have the incredible blessing of learning to know, live with, learn from, and better the lives of 100 different kids. Thank you.
Thank you, Arnie. How about another hand for Arnie? Thank you for all that you do for kids, not only in your state, but across the country. Thank you very much. Thank you, Daniel, for inviting the Alliance for Strong Families and Communities to participate in this very important dialogue. We are certainly honored to be partners with the Chronicle of Social Change on the Who Cares project. There certainly is no greater responsibility than caring for our nation's children, especially those who have experienced abuse and neglect. As Daniel mentioned, my name is Jennifer Jones, and I serve as the director of the Change in Mind Institute for the Alliance. I have also worked at the Wisconsin Department of Children and Families as a child welfare policy analyst, and at the Wisconsin Children's Trust Fund, leading the state's child maltreatment prevention efforts. So I want to start off just sharing, and I know it's sort of weird, you have to kind of go like this, but I want to start off just sharing a little bit more about who we are. The Alliance for Strong Families and Communities works to translate knowledge into best practices to improve outcomes for our communities and our kids and our families and realize our vision of a healthy and equitable society. Our Strategic Action Network works with thousands of social sector professionals across the country every single day to help them build, maintain, and restore their physical, emotional, social, and economic well-being. And to achieve equity, we are focused on a set of long-term outcomes that you see up here in 4 strategic areas: population health and well-being, economic support, economic opportunity, educational success, and safety and security. So the Change in Mind Institute, we have seen over the past 2 decades an explosion of new knowledge, research, and evidence on how the brain develops and how toxic stress can alter the brain's architecture. So through the Change in Mind Institute and our many partners in North America, the Alliance continues to innovate, to learn, and to build on the latest advances in neurosciences in ways that will promote a culture of health and well-being for all. The Alliance also houses the Within Our Reach office with funding and support from the Casey Family Programs. The office is led by Terry Covington, one of the commissioners on the Commission to Eliminate Child Abuse and Neglect Fatalities, and focuses on implementing the recommendations made in the report of the same name. So I want to share with you some of the challenges that we see in our current child welfare system. I'm going to highlight several key issues, but please know that there are certainly many more in what is a very complex and complicated system. And some of our panel members have already mentioned some of these. Instead of supporting birth parents and providing them with the services that they need to keep their children safely in their own home, the system is designed to remove children and place them with caregivers who are often unknown to them. Research shows that children removed from their homes has just as profound of an impact as the reason for removal. And in fact, let's take a second and imagine a young child in your life. Visualize that child being taken from their parents and dropped off in a home with somebody that they've never met. Imagine how frightening that experience is and how traumatic being taken away from everything they know with no idea of when they will return home. We spend very little resources on the prevention of child abuse and neglect, and instead wait until something seriously happens before we intervene. We put a significant amount of expectations on the system and ask them to be everything to everyone. There should be a child protection component of a larger child welfare system that is limited to the protection and the safety of children as mandated by law. This broader child welfare system would be the responsibility of all of us and focus on ensuring the health, safety, well-being, and well-being of all children and families. As reported in Who Cares, a significant number of states are heavily reliant upon relative caregivers without providing them with the adequate financial support and other services needed to appropriately care for their relative children. Relative caregivers should not be treated any differently. They should be offered the same case management services, and the same effort should be made to achieve permanency. All too often, children are placed with their relative caregivers and then left alone with very little or no support. As Daniel reported earlier, we are experiencing significant shortages in the number of foster parents. At the same time, the foster care reimbursement rates aren't even close to what it costs to raise and care for a child, especially one who has experienced significant trauma. And lastly, we have significant variation in how our system responds, depending on whether the family lives in a county or a state-administered state. As a result, families' access to services and supports vary greatly between counties and between states. So we should work to ensure that every child and every family, regardless of where they reside, has access to the same high-quality services and supports. And so I want to share a little bit with you about our vision for a 21st century child welfare system. Susan Dreyfus, president and CEO of the Alliance for Strong Families and Communities, coined this term, the 21st century child welfare system, when she was commissioner of the Federal Commission to eliminate child abuse and neglect fatalities. Since she originally articulated this need for a 21st century system, many leaders in the field that are working on child welfare issues have been meeting to identify a vision for this new system. We believe a 21st century system is preventative, science-aligned, and focused on keeping children safely in their own homes with services and supports. And in fact, all of you are very familiar with the Families First Prevention Services Act. That moves us in a direction by placing an emphasis on prevention, early intervention, and evidence-based practices for children and families. This groundbreaking legislation allows us to rethink the policies, practices, and systems of yesterday and reshape our nation's child welfare system. There are a number of components that we believe are essential to this reform system. It should take a public health approach. It should use predictive data analytics in a responsible way to identify high places where child maltreatment and related fatalities are likely to occur and employ more evidence-based interventions and strategies that we know work. At the same time, it should invest in and support innovation to identify new interventions and strategies and evaluate those so that we continue to build knowledge in the field. It should be more strategic and intentional about aligning with the latest advances in neurosciences. The research and the science is very clear, and the case for infusing this knowledge into the child welfare system is very compelling. What we now know holds great promise for improving the effectiveness of services to children, families, and communities. It should incorporate meaningful and intentional ways to include the voices of those with lived experiences, including birth parents and foster parents and youth who have experienced foster care. And finally, it should professionalize treatment foster care by providing salaries and benefits for caregivers who take care of foster children who have significant needs and require substantial treatment. These individuals would be educated in the science and the impact of trauma and work in close relationship and partnership with the family, with the birth family. This should not be what people do when they come home from a full-time job. This should be their full-time job, and they should be adequately compensated. As you can see here, there is a difference when you take a public health approach versus the current child welfare framework. A few key points. One is that there's an emphasis on health equity. Two, it uses the social determinants of health framework. It uses data to identify population health risks and needs, and it engages the community and other key systems and stakeholders. When we move towards a public health approach, we move from a protection focus, we move away from a protection focus to a prevention focus, and we pay specific attention to the social determinants of health. We know that our health is determined in part by access to social and economic opportunities, to the resources and supports available in our homes and our neighborhoods and our communities. In a public health approach to child welfare, we pay attention to things like housing and transportation. There is a broader ecosystem of interrelated players and a larger shared responsibility to the welfare of all of our children. Families and communities should have access to those strategies we know work, like child care subsidies, home visitation, parenting programs, trauma-informed treatments, and other evidence-based strategies as identified here by CDC. The Center on the Developing Child at Harvard University has identified these 3 core principles that will improve outcomes for children and families and can really help guide us as we choose the best approaches at the practice and the policy levels to build healthy brains and promote optimal child development. So thank you again for this opportunity. The Alliance is committed to working closely with our partners across North America, like the Chronicle of Social Change and others, to advance this new vision of a system that takes a public health approach to one of our society's most complex and challenging issues, and places priority not only on preventing adverse childhood experiences, but supporting responsive relationships between children and their caregivers and promoting positive child experiences. So I look forward to our conversation and dialogue. Thank you.
Okay, so I would love to ask a quick question of you, Jennifer, just because you said it, so I'm going to follow up on it, and then I'd love to open it up to the group. A lot of people here are clear experts on child welfare policy, and a lot of you are, probably new to Congress, so there's stuff to be learned here today, and I think that that's really important. There's a lot of change happening on the Hill today, so it's a first day back, right? So thanks for making it out. But Jennifer, so you mentioned this kind of professionalized treatment foster care workforce. You were very high up at a system, child welfare system. Arnie talked about it. Joanna mentioned it, the rates that are actually being given. We have a big move coming with the Family First Prevention Services Act, wherein the tight restrictions on congregate care are not exactly being matched with promise of increased rates to foster families. How are you, from your perch in the Alliance, going to move towards that? Or how would one move the federal government towards that?
I think, again, is this on? I mean, you can probably hear me even if it's not on.
Did you just press a button? Yeah.
There we go. So again, I think one of the visions that Susan has, and she's had since she was an administrator of a child welfare agency in Wisconsin and then the secretary of the Department of Health and Social Services in Washington State, is this concept that we should consider professionalizing treatment foster care, and that instead of providing reimbursement rates, that we actually provide salaries and benefits, and that it's considered a full-time job. And so that we, especially when folks are caring for kids that have experienced significant trauma, significant adversity, and they have significant and substantial treatment needs. And so providing these folks with the adequate compensation and the adequate reimbursement that they need in order to provide that care. So I think, in answer to your question, Daniel, is that we need, as we all, as national partners, as we all think about and rethink what our nation's child welfare system could be, I think this is an important, we think it's an important component to that system. And so what do we all together do to advocate to make sure that that's a reality?
Joanna, you mentioned that you're going to be going a little bit deeper in the research. Can you kind of talk about that? Because I think that's going to kind of tease out what you're talking about to some degree, Jennifer, places where maybe we've seen more investment and how that's affected capacity. So what's the next steps for you in your work?
Right. So right now with the field center team, we've been looking at the data and identifying cases where states have increased, for example, their payments to foster parents. But at this point, we haven't dug into why they increased the payments and what was the policy or the thinking behind it. So in our next step, we are together with field center interns, we are collecting information on changes in policies at the state level. For example, perhaps decisions to better compensate kinship foster care, for example, might be one of them, and try to focus on a few of those specific changes and then track those through our large data set to understand the consequences of specific policy adjustments rather than looking like in general when payments increase, which is what we've done so far. And hopefully that will provide us with much more specific tools and deeper understanding of the phenomenon at hand rather than looking at it on average, which I think is also interesting in terms of giving you a message. And, for example, we got this estimates about a 10% increase in payments can increase placements by a certain amount. That means, for example, that with that you can roughly project how much more would you need to pay if you wanted to, cover this many additional kids who are right now in group homes. So that's what this can roughly serve us for. But again, I think we're going to be able to say more once we dig into the details of some specific policy changes that states have done. And, as usual in the US, and I'm looking at this in my other work, states as the laboratory of democracy. States try different things, and this way some of them hopefully will discover effective policies. And it's our job to look at it, see what happens, and learn from those policies to potentially generalize it to more states and potentially through federal policy.
Yeah, it's going to be very exciting to see, and for all of you here. So as that new research comes online, we'll be moving it onto the Who Cares website. So this website, fostercarecapacity.com or .org. We have both URLs. We'll just start dominating all URLs. You will be able to go there and see as this stuff comes out. One question to you, Arnie, and then I want to hear from the group. What is the current foster care stipend in the state of Maryland?
Basically, it's like $835 a month.
When was the last time that was adjusted?
7 years ago, I believe.
7 years ago. And you obviously have voiced concern about that being sufficient, given. And so my question to you is have there been concerted advocacy efforts to try to move that number up? And if so, why have you not been able to get the rate up? What's the barrier?
Well, we haven't done anything in the last 5 years or so. We're currently working right now to craft a bill, find a sponsor, which is not always something that's easy to do. Because if you don't have the state DA, the State Department backing you, you're going to have to work through it by yourself. Mm-hmm. And so the idea is that we're in the discussions right now of how would we do that, what would they be happy with, but once you get a bill passed, it still has to go through budget. So then there's a lot of barriers.
All right. Do we have any questions from any of you about either the work that my organization did, that Jennifer's up to, Arnie's experiences and efforts on the state level, or Ioana's forthcoming work and her work thus far? Yes, Teresa.
Hi, I'm Teresa Wilson, reporter at State Line Charitable Trust. You mentioned that in places where the housing is more expensive, there's fewer placements. Are those states also the ones that use congregate care the most?
That's a great question. We haven't looked at that, but it's something that... The microphone isn't on. I said that's a great question. We haven't looked at that, but it's something that we could potentially check in the data, because I believe we have data on placements in different settings, and right now we focused only on foster parents and didn't look at those other placements, but it would definitely be an interesting thing to look at going forward. So thanks for the suggestion.
Yeah, and if you look also at the Who Cares website, we're updating it now with the 2017 numbers because the feds just released them last week. So we will be able to see, you will be able to see state by state where that is now relative to where it was in the past. So you will have some of that. But remember, these are actually placements. These are like the kids that are in the homes, as opposed to how many beds are available for the kids, which there is an important distinction there. Other questions? Yes, Jaya?
Jaya with Generations United. I wanted to, first of all, appreciate you highlighting the discrepancy between what relatives and foster parents or non-relative foster parents have paid. It's a long-standing discrepancy. But wanted to also highlight that there are a couple of opportunities in the Family First Act that we should really be watching, because as we know, passing legislation is the first step, and making sure it's implemented in a way that follows the intention and fidelity of good approaches is what makes all the difference. And one piece is that it does call for states to measure their licensing standards against model standards, and the eye for that for model family foster care licensing standards is to address those barriers to licensing relatives that I think Arnie highlighted are in place. So if states can be looking at how they can be adapting their licensing standards to provide more opportunities for relatives to get licensed, that's going to help. We then, of course, have to also pay those licensed relatives at the same rate as non-relatives. But in addition to that, there's an opportunity with prevention services. So states can pick up the opportunity to provide time-limited prevention services to relatives that are stepping in to care for children while the birth parents are trying to get services as well. During that time frame, we should be educating relatives on the opportunities related to becoming licensed versus not being licensed. And what we heard from again and again from relatives is so often they weren't told that they could be licensed, or they weren't given time to learn about the difference between licensure and not licensure. And this provides a window to educate the relatives about the difference between licensure and non-licensure, to be making the decision, an informed decision about those opportunities.
Just a point of clarification. So you're saying, so Family First opens up the entitlement that pays for foster care to now a new class of beneficiaries, parents who would otherwise lose their children to the system. That's not been defined yet. Jeremy and his shop are writing the regs right now. But there's 12 months of time-limited services to those families. What you're saying, but during that period, the child doesn't enter the system, so the family is not entitled to any kind of Title IV foster care services remuneration. What you're saying, that's a window to educate them in the event that the child enters?
Right. So during that period of time, they aren't going to receive financial resources through Family First, but they do receive prevention services. And if the child is not able to return to the birth parent during that period of time, it could be that the child then is going to be permanently with the relative. So then the question is, does that relative become licensed, or does the child stay with the relative who is not licensed and is raising the child outside the system, in which case they would get less support and services. And so I think we really need to be watching how states are handling that period of time, if they do offer prevention services, so that relatives can be educated on the difference between raising the child outside of the foster care system through prevention services and becoming licensed and getting the full support that comes with licensure. So how that's implemented is really key and an important piece for advocates.
Jennifer, you're nodding. Did you have a thought?
Well, I just think that's a really interesting point. I think part of the challenge, too, is what are going to be defined in the clearinghouse for evidence-based interventions and services. And I think there's a very limited amount of interventions that we know about that are evidence-based. And so, again, I think it's a very interesting point. I think we should absolutely pay attention to that, and how can we use that as a means to support, to better support relative caregivers that may choose not to be licensed.
Yeah.
Navigators are also fundable through this, and so those navigator programs provide information and resources to them, and those states actually got recent money to do that, so that's an opportunity for those navigator programs to provide.
Just one other quick thing. I think it's also a call for us, and us meaning sort of on the social services side, to make a point of talking about and moving any of those sort of interventions and strategies that we engage in with kin and with relatives that may not be evidence-based or even promising. So to really start to push ourselves and move our field to do more research and to do more evaluation, so that that clearinghouse and the interventions that are covered as part of the prevention services piece, there's more of them, right?
Deirdre, as far as the Dalton Daily Group, just to put a finer point, you were making a point that sort of bubbled up for me as well, because we've been working on licensing for a long time, starting in fostering connections and really trying to give states the ability to be lenient when it comes to licensing kin, and thought that in that leniency we would see a lot of forward motion, and of course we didn't. I think the fine point that I want to put on it is to really, once again, like pull us back to real world situations. A lot of the work we're doing in Chicago, we find that relative placements are sometimes used as I'll speak plainly amongst friends, you know, sort of as a threat. The kid either goes with your sister or comes into the system. So really having a cultural conversation and the complexities of that about then said sister or aunt or grandparent, then involving the child again in the system when the reason they were with kin was to avoid the system. And so really wanting to be culturally competent about that and thoughtful about that and the realities of what system involvement means for families. So I think I wanted to say that. I wanted to commend you, Arnie, thank you so much for your work, and really want to think about ways in which we can talk about Maryland and some things that we can improve on a state-by-state basis, because one thing that was really true is that it happens with groundbreaking work in states that then the federal government picks up. I think those were the most pressing things on my mind, although there were a couple of others, but I'll stop there.
Well, we got a question back there as well, and so, but I think there's an interesting thing. So California, okay? California now has, for a long time, didn't pay relatives as much as they paid non-relative foster parents. And so what they did you have thought, you got to finish up your thought?
Thank you, because that's the other point, is a lot of the times, and Rep. Bass made this point, for policymakers, the trust of family once something has happened within the family, and if we are to pay, this is not me, but other folks who have made policy, and I've heard this conversation, if we're gonna pay relatives what we would pay non-relatives, then they must comply to everything that a non-relative must. There's this seeking equivalency, and at the same time, I'm asking for leniency because they're not equivalent. It's different if two cousins are sharing the same room. It's different if, and so how do we, I think these are larger questions that start filling out your other questions that frame the discussion for us in more specificity. How do we deal with the equivalencies and then also the things that make kinship very different, and how do we account for both in a way that feels fair to everyone?
Well, I mean, yeah, I mean, California has now got the equal process. Everybody does the same thing. They got to jump through the same hoops, and they had delays. You know, they were supposed to do it in like 3 months. They were taking, I don't know, 400 days. I mean, it's crazy. They were taking a long time. I don't know that. Don't quote me on that number, but they were taking a long time. And so I think you've got this question of how do you actually how do you create a system that's not a system for kin? And we were in Atlanta and having this conversation, and Sharon McDaniel, if anybody wants to know somebody who's smart on relative stuff, she took Allegheny County. Now that 68% of their kids are placed with relatives in Allegheny County. I mean, they get a lot of love because they do good things, but 68%, I mean, that's crazy. The national average is what, 32%. So they're more than twice as much. And, you know, it's a different kind of relationship that a system has to have with relatives, and how can we provide resources to families? Because we know, research will tell you that relatives, often, the relatives that we rely on in the foster care system are not necessarily socioeconomically, they're not rich, you know? And they've got to, I talked to a 72-year-old man, baby shows up on his door, take this kid. If you don't take this kid, this is your little baby granddaughter, you know, she's going to go in the system. He's sleeping with her that first night and worried that he's going to smother her, you know? And what are we doing to help those family members? You had a question back there.
Growing up in the foster care system myself, I understand, you know, the quality over quantity. So I hear a lot of people, you know, we need more foster parents, but honestly, like, we need to attract the good in people. And I think a lot of states tend to not do that. Like, we need to get as many as possible as we can to support these kids. Well, growing up in the system, that's just not good. That's not good policy at all. I do like the salary. I understand my foster parents, you know, drilled it into us to go to school, but also they were taking time out of their income, you know. My parents working 2 jobs as well, so I understand that. I do think salary-wise, it entices people to come towards foster care, more of a balance. So I don't know if that's what you were saying or not with salary. But I'm also concerned aged out foster children. I was fortunate to go to college and I had to bust my tail, but there's most kids that don't get that and they can't really come back to their parents for support. Like it's in bylaws saying, you know, you're not allowed to come visit your foster families. You can visit them, but if you are homeless, which many foster parents do, foster parents, foster kids happen to, they become homeless. The opioid epidemic, quality over quantity as well, socioeconomic status. It's the reason why parents sometimes push the drugs onto the kids. So it's not just, it's kind of a balance of both. So my question to you is for aged out foster children, I looked at Chaffee, I got Chaffee, you know, like, but that's just not enough. You know, I worked 4 jobs while getting 3 bachelors. So it's like, it's just not enough for children. So I'm wondering with policies, will that increase as foster parents get salary or getting a wage increase?
Can I just shoot it back to you real quick? Because you're working for a congressman from Kentucky. You're in U.S. Capitol after, you know, it's a time of change. You can do things. So, I mean, what would you say to that? I think I'm sure that Arnie's got an opinion and Jennifer's got an opinion. Ioana's got an opinion. I've got an opinion, but it's probably pretty dumb. So, I mean, what would you do? What would you do?
Honestly, for me, I grew up with 4 other foster brothers, and every single one of them failed. You know, they ended up in prison along these lines. Honestly, it's from the start, and it's getting foster parents, one, who know their education. But honestly, they really don't have to know their education. They just have to be able to transport you to tutoring services. I never considered myself smart, but you know, I was able to get it done in school, but they weren't. So with that being said, I think with the Chaffee program too, there needs to be classes with that, because most of the foster brothers that did receive it that I knew of, I mean, what's a young dude gonna do when he's 19? We sure ain't going to class, and you're gonna try to blow it, you know, like. So I do think there's classes that need to be set up, but there needs to be more money towards that Chaffee. $1,250 is not enough. And you know, I didn't basically live off that, but it did kind of help support, you know, getting rent, buying gas for your car. I gotta get books for school. Not every state will pay for your college after you get done with high school. Some kids get affordable housing and they have to work it out that way. But in Kentucky, you're kind of blessed to have your school kind of paid for. But it still means you have to work your tail off. You have to at least keep above a 2.5. So I think with that being said, with aged out foster children, I think that is probably one of the biggest issues that need to be looked at regarding policy. And I don't know how I'm here on the Hill. It just kind of happened, but this is kind of what I came to the Hill for.
I think you'll find you've got a lot of foster brothers and sisters on the Hill, for sure. Just got to look around a little bit. There's a lot. Do any of you want to react? Arnie?
Well, I would like to say I understand the drive or what giving foster parents a professional salary would do. But I think that money, for me, does not solve the issue. For me, money only would give me more time, because time is where you build an attachment. Time is where you build connections. And research says that attachment trumps trauma. Kids that have come into care have all of them have some kind of trauma. It's important for me as a foster parent to make sure that I have the time, the keeping in touch with what's happening currently, so that I can connect with the kids. Because if I'm not going to connect any amount of money to me is not worth it. And connection is what really matters. We also have to make sure that the caregivers are competent in connection.
I just want to say your voice is the most important voice that we have, right? So use your voice, use your experiences, tell us what it is you need, what you think is the most important thing, and we will advocate as best we can. But I think use your experience and use your voice, and you have a great place and an opportunity to do that. And congratulations on all that you've done so far.
I think we're going to wrap up pretty quick here, but I wanted to offer 2 more questions to anybody before we do. So does anybody have another question? Yes?
Hi. I noticed that the report doesn't specifically list any demographics or race or ethnicity for foster parents specifically. And one thing that we are finding with research is that as we are working to eliminate congregate care, LGBT youth are more overrepresented in congregate care, more so now than before, because as we work to put more kids in foster homes, LGBT youth are often either, I hate using this term, but blowing the placement due to self-identifying, or they are worked against in the system, and they're kept in congregate care because it's easier to keep them there. And so I was wondering, how is this report working to address that specific issue, or is it, or is that?
Well, I think it's a great question. I think you want to tell us about I mean, the census data. I mean, that brings you down to some kind of more granular detail. So maybe can you tell us about that a little bit?
Yes, so in the census data we can identify race. However, unfortunately, we can't identify LGBTQ, status, and that's part of the issue. I believe it's not in our administrative data either. So I think that's part of the difficulty in researching that angle on the LGBTQ population. But the racial thing is something that we can potentially look at.
And I think we will be updating this report. It's a website, so we'll be updating it constantly. So I mean, I think this is great. I just took a note of that. I think we have to do that, and I think that you're bringing the LGBTQ question is really huge. I mean, I think in LA County, 20% of the kids are in foster care are identifying as LGBTQ, and again, back to Arnie's point about recruiting the foster parents who are going to make the time to understand and do that. I think that you can't be just, you got to be really thoughtful about it. And I think it's a really important, a very important question. Okay, one more. Teresa, again.
Not to my knowledge, and you may know differently, Daniel.
That are professionalizing
That
care.
have actually implemented this sort of concept of professionalizing treatment
Some
foster care.
pilots going around. I mean, I think there are some pilots. I should know better, but I don't.
Yeah.
I don't have the answer.
But certainly something that we should consider, right? And then learn from those states and do the research and the evaluation that we need to prove that it works. I want to just say one thing about the LGBT issue. I think the other thing we need to spend some time on and advocating on are the religious exemption laws that are specifically targeted to LGBT people and placing foster kids in LGBT homes. So I think that's a huge issue that I think we need to address in all the states.
Thank you. I want to thank everybody for coming out. I want to thank our sponsors, the Alliance for Strong Families and Communities, the Foster Family Treatment Association. Binti is a software program that helps hook up foster parents with foster kids. The Field Center at UPenn. Thanks to our sponsors. I want to thank Nina at Office of Representative Karen Bass for being so helpful in terms of working with my staff to give us a place to have this conversation. I want to thank all of you for coming out. And we got the room for a little bit longer if you want to chit chat. But thanks for coming. And we are a resource. Read our publication. You will learn some stuff. And if we get something wrong, tell us so we can fix it. But thank you very much.